Your liver is a pretty important organ, bigger than your heart or stomach, right behind the lower ribs on the right side of your body. It does a lot of things to keep you healthy. It stores the vitamins, sugars, fats, and other good nutrients from the food you eat. It makes some of the substances your body needs, and makes sure your body gets the right amount of other substances it needs. It breaks down harmful substances like alcohol or poisonous chemicals. It gets rid of waste products in your blood. It fights infection and helps stop bleeding. The most common forms of hepatitis in this country are hepatitis A, B, and C. The main differences are how you get each virus, how long you have it, and what each virus can do to your liver. The word hepatitis means swelling or inflammation of the liver after it's been attacked by a virus. A, B, or C refers to the kind of hepatitis virus that's making your liver sick. Hepatitis C, or HCV, is spread by direct exposure to blood, like can happen if you share drug works or snort cocaine or meth. You can get it through body piercing or getting a tattoo with a contaminated needle. If you're a healthcare worker, you can get the hepatitis C virus if you accidentally get stuck with a contaminated needle. Hepatitis C can be spread by unprotected sex with someone who has hepatitis C, but this doesn't happen often. You might be exposed if you get hemodialysis or if you had a blood transfusion before 1992. The symptoms are often mild, and sometimes treatment can eliminate the virus from your body. The danger with hepatitis C is that up to 8 out of 10 people who are exposed to it develop chronic hepatitis C. They have it for the rest of their lives unless they get treatment. Many people with hepatitis C may remain healthy, especially if they have good health habits. On the other hand, out of the 8 people with chronic hepatitis C, up to 4 may progress to cirrhosis. About 1 of those 4 experiences liver failure or gets liver cancer. In fact, HCV is the leading reason that people need liver transplants in the United States. The best way to keep from getting hepatitis C is to avoid coming into contact with other people's blood. Here are some of the most obvious ways. Don't share personal items that might have blood on them, like razors and toothbrushes. Don't inject drugs. If you can't stop, use a new needle every time, and don't share your needle or works with anyone else. You can buy new needles at a pharmacy without a prescription. Use a new condom or rubber every time you have sex. The virus usually can't get through the latex barrier. The risk of transmitting hepatitis C sexually is actually pretty low. If you're a healthcare worker, handle needles and other sharp objects carefully and report any needle stick or other injury to your supervisor. Your doctor can tell you about more specific risk factors for hepatitis C and how to avoid them. What you do about them can be a life-saving decision, because up to 80% of patients develop chronic hepatitis C after their first exposure to the virus. If the test shows that you have the hepatitis C virus, the most important thing to know is that there are treatments for it. In some people, the virus can be totally eliminated. But even if that's not the case, you can live a long time with hepatitis C if you learn how to protect your liver from further damage. Getting vaccinated for hepatitis A and B is one thing you can do, because if you have hepatitis C, you have a much greater risk for complications if you pick up another virus. Another important step is to stop drinking any alcohol. A drug or alcohol problem can make many health challenges harder to manage. The opposite is also true. A health challenge can make it more difficult to overcome a drug or alcohol problem. Excessive drinking or hepatitis can do significant damage to your liver. If they occur together, the damage can be much worse, with serious consequences to your health and your recovery. That's why it's important to be tested for hepatitis.